Let me tell you about how a foot doctor diagnosed a medical instrument left inside my client's belly by a surgeon. Hi, my name is Stuart Nachman, and I am a trial attorney with the law firm of Kalfus and Nachman here in Virginia. My client had a very complicated surgery that lasted well over 5 hours for an aneurysm in his abdomen. The surgery appeared to be successful, with one minor exception. My client continued to have significant abdominal pain. He complained about it to the surgeon in follow-up visits. The surgeon said, "Oh, that's just part of the surgical healing process, and in time, that pain will go away." Unfortunately, it didn't go away. And he continued to complain, particularly at night when he would get up out of bed and have to bend over. The pain was excruciating. Well, my client had other medical problems, including issues with his feet. So several months after the surgery, he's seeing his foot doctor or podiatrist. And while the doctor is tending to his feet, my client complains to him about this ongoing discomfort in his abdomen. The podiatrist, being the good doctor that he was, suggested that he have an x-ray taken of his abdomen. So my client went directly to the hospital, had the x-ray taken, and lo and behold, there sitting in his abdomen is a 13-inch by 1-inch instrument called a malleable retractor. Except it's not very malleable because it is made out of thick steel and looks like a large tongue depressor. So you can imagine bending over with this large object in your body, the type of pain you would experience. Fortunately, he came to see me after what would otherwise have been a needless surgery to remove this offending instrument. And I was able to help him by getting just compensation for all the suffering he experienced, not only from the second surgery, but all the suffering from the 2 to 3 months he suffered with this metal object in his abdomen, and the recovery from the second surgery, which otherwise he would not have to have undergone. It was a complicated case in certain respects, because the question was, well, was it the fault of the surgeon, or was it the fault of the nursing staff that was assisting in the surgery? Naturally, each was pointing the finger at the other. Fortunately, we were able to get compensation from both sources to get adequate compensation for my client. If you have a problem that you think involves medical malpractice, I want you to pick up the phone and give me that call at the number that appears on this screen. I'm Stuart Nachman, and I thank you for watching this video.